Magandang RMMC! Today, our group was assigned to discuss topics that is essential and somewhat related to the overall objectives of our subject. But before that, let's do some warm-up activity that will help you to know on what are we going to discuss today. So, for our warm-up activity, this will be related to the famous game 4 Picks, 1 Word. So, are you ready? Let's start! Can you guess what these pictures are trying to portray for? You have 10 seconds to think what this is. If your answer is bandaging and taping techniques, you are right. Next to our last phrase. Yes, that's right. Injury rehabilitation is the answer. Now that your minds are on fire, let's proceed to our formal discussion. Today, we are going to discuss the bandaging and taping techniques as well as understanding the basics of injury rehabilitation. So, for our learning objectives, at the end of the discussion, the students must be able to first discuss the different bandaging and taping techniques. Second, know the difference between bandages and tapes as well its appropriate usage. Third, comprehend the basics of injury rehabilitation. Next, differentiate the therapeutic exercise to conditional exercise. Next one is to discern the basic component of rehabilitation program. Next, perform at least 3 bandaging and taping techniques. And lastly, deliberate on the importance of bandaging and taping techniques as well as the basics of injury rehabilitation. As for our discussion overview, our group will going to discuss the purpose of bandaging and taping techniques, difference between bandage and tapes and usage and applications, types of tapes, taping preparations, usage, rules and the removing process, common taping techniques, the difference between therapeutic versus and conditional exercise, the philosophy of athletic injury rehabilitation, and lastly, the basic components and goals of a rehabilitation program.
Now, let us discuss the different bandaging and taping techniques. Bandaging and taping are routinely used for various reasons. First is to provide compression that would help minimize swelling or an abnormal enlargement of a part of our body. Second is for injury prevention, and third is to provide additional support to an injured structure of human body. Accordingly, bandaging and taping techniques or skills are not that difficult, but its application requires trained individuals that has advanced experience and skills to properly perform its techniques. But there are some nuances or differences in terms of taping techniques because some technique may work for other athletes but not for the others. So there should be adjustments to be made. As you can see here, taping and bracing are both effective in providing support or injury prevention. And both of them, their tape application can be time consuming. But always remember that it should never be used as substitute for rehabilitation because correcting a deficiency or weakness is different to using tape or brace as an adjunct or support for the correction. Let's start with elastic bandages. So elastic bandages can be used for a variety of purposes. First, it is to compress acute injuries to limit swelling. Second, to secure dressing or ice pack. And third is to provide support to injured soft tissue structure. We can use gauze, cotton clothes, and elastic wrapping. Its length and width may vary based on the size of the body part of the injured person. So, its size may range to 2, 3, 4, 6 inches width and 6 or 10 yard lengths. So, here are 9 ways or processes of bandage application. First, hold bandage and preferred hand with loose end and extending from bottom of roll. Second, back surface of loose end should lay on the skin surface. And third, pressure and tension should be standardized. And fourth, anchor is created by overlapping wrap. So we should start the anchor at the smallest circumference of the limb. And body part should be wrapped in position of maximum contraction. And six, we should recognize the difference of more turns with moderate tension and fewer turns with maximum tension, depending on the size of the bandage, size of the body, and the level of the injury. And next is, remember that each turn should overlap by half to prevent separation. Then, begin distally and move proximally. And the last is, we should observe if the circulation is present when the limbs are being wrapped. Elastic bandages can be used to provide injury prevention and provide help for different acute or minor injuries. Just like in the picture, it shows where the elastic bandages can be applied. First is ankle and foot spica, lower leg spiral bandage, groin support. Our groin can be located in the area of our hip between our stomach and thighs. So next is shoulder spica, elbow figure 8, and hand and wrist figure 8. Let us now proceed to non-elastic white tape. Accordingly, this is somehow better to use because of its great adaptability. Just like uniform adhesive mass, adhering qualities, lightness, and relative strength. Non-elastic white tape can help hold dressings and provide support and protection to injured areas, same as the bandage. And it comes with varied sizes, whether it's 1, 1.5, or 2. So according here, in purchasing a tape, we should consider the following. First is its tape grade. So, it refers to its longitudinal and vertical fibers per inch. More costly, heavier tape contains 85 horizontal and 65 vertical fibers. Second is the adhesive properties. Here, we should adhere regularly and maintain adhesion with perspiration, or it should have the ability to be attached on the skin. But when it's attached on the skin, it should have few skin irritants. So, it should be easily removable and should not leave a residue and superficial skin. The last is its winding tension, because it is critically important. Because if it's applied for the protection, tension must be even. Now, let us proceed on techniques on tearing tapes. According here, various techniques can be used, but we should allow the athletic trainer to hold on and roll the tape. Then, an athlete should remember to not bend, twist, or wrinkle the tape, because we should make sure that the tearing of tape should result in straight edge. That is why some requires cutting agents. Here are 3 ways of removing adhesive tape. First is the manual removal. In this, we should always pull the tape in direct line with the body. It can be done through using one hand to pull the tape and using the other hand that presses the skin in opposite reaction. Next is using of scissors and cutters. They're also called tape remover, such as alcohol-based liquids, scrubbing with towel or clothes, and washing the tape remover off with soap and water. The last type of tape is what we call waterproof tape. This tape can be used on the sports played underwater, just like swimming, because it is removable. Now, let us know the rules for tape application. First is we should tape in the position in which joint must be stabilized or balanced. Then, just like bandage, we should also overlap the tape by half, but we should always avoid continuous taping. Next is we should keep the tape roll in hand whenever possible. Then we should also smooth and mold tape as it is laid down on skin and allow tape to follow contours of this skin. Another rules are that we should start taping with an anchor piece and finish by applying a locking strip. And where the maximum support is desired, we should tape directly to the skin. Then last is we should not apply tape if skin is hot or cold from treatments. Now, let me show you the common taping techniques. Let us start with arc taping, then great toe taping, toes, then closed basket with ankle taping that can be used for newly sprained ankles and to also utilize weak ankles. There's also called Achilles tendon that prevents Achilles from overstretching. Then there's also knee taping and elbow taping that can be used to prevent hyperextension. Then the next one is wrist that protects and stabilizes badly injured wrist. Then the last one is thumb that can be used to provide support to any joints.
Before we proceed to the next topic, let us do some assessment if you really have listened to the discussion. So, do you think that taping and bandages techniques is essential to be learned and remembered? What about in the context of the athletes?
Understanding the basic of injury rehabilitation. So the philosophy of athletic injury rehabilitation, while the majority of injuries do not involve long-term rehabilitation program, those that do require supervision of highly trained professionals. So coach should rely on athletic trainer to design, implement, and supervised rehabilitation. Coach is limited in the extent to which he or she can legally be involved in supervising or design a program. Okay? So swelling and pain control should be provided immediately. Coach can be involved initially in application of first aid. So, goal of athlete, return to activity as quickly as safely as possible. Okay? So, must be prudent in decisions regarding aggressiveness of treatment or rehabilitation. So, a mistake in judgment by the individual in charge of the rehabilitation could hinder the athlete's return. So now let's proceed to some exercise that uses in rehabilitation. Okay, first is therapeutic exercise. This exercise is used as part of rehabilitation program. Next is conditioning exercise. Activities that are used to minimize injury and maximize performance. Now let's proceed to basic components and goals of a rehabilitation program. So first, must be addressed several basic components. Next is short-term goals. Okay, so these are the short-term goals. Provide correct and immediate first aid to control swelling. Next, control pain. Restore full ROM or ROM. Next is restore core stability. Restore and increase strength, endurance, and power. Re-establish neuromuscular control and balance, and of course maintain levels of cardiovascular fitness. So next is long-term goal, return to play. Now let's proceed to providing first aid and controlling swelling. So initial first aid is critical, should be directed towards swelling control and utilize the Price principle or PRICE principle. Okay, so each factor is critical in limiting swelling. So, coach should be capable of providing first aid regardless of whether an ATC is present. So in controlling pain, so some degree of pain will be experienced. So pain will be dependent on the several factor. So severity of the injury athletes response perception of pain and the circumstances. So PRICE or price and additional modalities can be used to help modulate pain. So pain can be interfere with rehab and therefore must be addressed throughout the rehab process. Restoring range of motion. Okay. Injury to a joint will always be associated with some loss of motion due to contracture of connective tissue, resistance to stretch of musculotendinous unit, swelling, and etc. Okay? So, athlete will need to engage in dynamic static or PNF stretching activities to improve flexibility. Okay? So now in restoring core stability, okay? So involves strengthening and lumbopelvic region and is critical for dynamic functional strength and movement. So without proximal core stability, distal extremity function become compromised, okay? So core strength and power must be emphasized early in the strength training program. Restoring muscular strength, endurance, and power. Okay? Among the most essential factors necessary when restoring function of a body part to pre-injury status. So, these are the variety of techniques that can be utilized. Isometric, progressive resistance, isokinetic, and plyometrics. Okay? So, emphasize work through a full ROM or ROM. So now, isometric. Performed in early part of rehab following period in immobilization. Next is use when resistance through a full range could make injury worse. Okay, take note of that. So, increase static strength, work to decrease or limit atrophy, create a muscle pump to decrease swelling. Okay, so next is progressive resistance exercise or PRE. Okay, so can be performed using a variety of equipment, utilizes isotonic contractions to generate force while muscle changes length. Okay? So last is concentric and eccentric strengthening exercise should be utilized. Okay? So that is progressive resistance exercise or PRE. So let's proceed in isokinetics exercise. So incorporated in later stage of rehabilitation process. So uses fixed speeds with accommodating resistance to provide maximal resistance throughout ROM, and speed of movement can be altered. Okay? So, commonly used as part of a criteria for return to functional activity. So, last one is plyometric exercise. So, incorporated into layer stages of program. So, uses quick stretch of muscles to facilitate subsequent concentric construction. Okay? So, useful in production of dynamic movements, so associated with muscular power and generation of force rapidly key to successful performance in many activities. Another one is reestablishing neuromuscular control and balance. Okay, so neuromuscular control is mind's attempt to teach to predict conscious control as a specific movement. Okay, it is relies on CNS to interpret and integrate sensory and movement information and then control muscle and joints to produce coordinate movements. Okay, so establishing neuromuscular control requires repetition of a same movement step by step until it becomes automatic. So progression from simple to difficult task. Okay, take note of that. So functional exercise are critical for establishing control. So now in regaining balance, ability to balance and maintain postural stability is essential to reacquiring athletic skill. So programs should incorporate functional exercises that involve balance training. So failure to include balance training may predispose the athlete to re-injury. Okay? So when balance is challenged, the response is reflexive and automatic. Okay? So the primary mechanism for controlling balance occurs in the joint of the lower extremity, and the ability to balance and maintain it is critical for athletes. So if an athlete is lack of balance and postural stability following injury, they may also lack of proprioceptive and kinesthetic. So information of muscular strength, which may limit their ability to generate an adequate response to disequilibrium. Okay? So, a rehabilitation plan must incorporate functional activities that incorporate balance and proprioceptive training. Okay, so in maintaining cardiorespiratory fitness, single most neglected component of rehabilitation when injury of course athlete is forced to miss training time, which result in decreased cardiorespiratory endurance unless training occurs to help him or to help maintain it. Okay? So, alternative activities must be substitute that allow athlete to maintain fitness. So, put into rehabilitation program as early as possible in rehabilitation program. So now let's proceed in functional progressions and functional testing. So first is functional progression. So involves a series of gradually progressive activities designed to prepare the individual for return to a specific passport activity. So sport-specific skill are broken into separate components. So athlete works to reacquire skill over time. Next is should be incorporated into treatment as early as possible. And athlete physical tolerance must be monitored. Okay? So if pain and swelling do not arise, the activity can be advanced. So new activities should be added as quickly as possible. Okay? So now in functional testing, uses functional progression drills for the purpose of assessing the athlete's ability to perform a specific activity. So, entails a single maximal effort to gauge how close the athlete is to full return. So, pre-season baseline testing for comparison post-injury. So, these are the variety of tests. First is shuttle runs, agility runs, figure 8, and Kurosha, Kuryoka. Next is Kuryoka test, vertical jumps, and balance. And the last one is hopping for distance. Okay? So now let's talk about in using therapeutic modalities. So incorporated into rehabilitation program as adjuncts to exercise. So these are those. Cryotherapy and thermotherapy, ultrasound and electrical stimulation, and the last one is massage and traction. Okay, so it requires a special instruction and supervised clinical experience. So in absence of ATC, coach may opt for simple modalities within scope of expertise. So ice packs or bags used for minimizing swelling and analgesia following injury. Ice bay flake or crushed and will be encapsulated in wet towel and plastic bag. Both are easily moldable to body. Okay, so elastic wrap generally utilized to secure pack in place for 20 minutes. Okay, compression and elevation are also used in conjunction with ice. So now in hot packs used post-acutely after swelling stop. Okay? So, has numerous benefits. So, these are those. Increase blood flow, facilitate reabsorption of injury byproducts, useful as analgesic, relaxation effects. Okay? So, be careful not to use too soon in healing process. Cold should be used for first 72 hours post-injury. Okay, so moist heat packs or hydrocollator packs. Okay, so silicate gel in cotton pads maintain in thermostatically controlled hot water or 90-60 Fahrenheit, 160 Fahrenheit. So retain water and relatively constant heat for 20 to 30 minutes and required to use of 6 layers of toweling to avoid burning patient. And athlete should not lie on the top of pack. Okay, remember that? So last one is massage. So systematic manipulation of soft tissues of the body involves gliding, compressing, stretching, percussing, and vibrating. So produce specific responses in athlete. Okay? Causes mechanical, uh, psy- uh, physiological, and psychological responses. So mechanical responses are direct result of graded pressures and movement of the hand on the body. So these are the benefits. Encourage lymph drainage, stretch superficial scar tissue, stretch connective tissue or friction massage. So increase circulation due to increased metabolism. So helps to remove lactic acid or edema and assist normal venous blood return to hot. So the last one is relaxation. Okay? So now the last part is criteria for full return to activity. Okay? Rehab plan must determine what is meant by complete recovery. So athlete is fully reconditioned, achieve full ROM or ROM, strength, neuromuscular control, cardiovascular fitness, and sports specific functional skill. Okay? So the decision to return to play should be a group decision or a sport medicine team. So team physician is ultimately responsible for this. Okay? That's it.
Now that the last topic is done being discussed, at this juncture again to know if you are still learning. So, upon learning the basic components and goals of a rehabilitation program, what do you think is the most significant component among the three being tackled and why? Now for our summary, taping and bandaging can be used to prevent injury from occurring or to aid in recovery or rehabilitation after injury. Preventive taping is the most commonly applied in joint areas to strengthen, support, or prevent the joint from exceeding its normal range of motion during movement. Able to know the basics of injury rehabilitation results to accelerated and better cognizant of the situations. The components and goals of rehabilitation program is to provide correct and immediate first aid to control swelling and of course to control the pain, maintaining the level of cardiorespiratory fitness and others. And that's the end of the discussion. In behalf of Group 7, allow me to thank you for listening and participating. See you again next time.